They say if you want something done, you should ask a busy person to do it. In Northern Health, Debbie Strang is that person, and she gets things done. Debbie has worked in a wide variety of roles during her 25-year career at Northern Health.
I've worked med-surg, I've worked pediatrics, I've worked in the operating room in recovery, I've worked extended care, and then 16 years in mental health and substance use. Then I went into leadership roles within Northern Health, starting with nursing unit coordinator, became a team leader, then on to manager, director, and now my current role of administrator.
In her current role, she leads approximately 450 staff members and has spearheaded numerous initiatives aimed at delivering better health care to communities in BC's central interior. One such initiative was in response to BC's opioid crisis. There were no on-site addictions treatment providers in Quesnel, which has been struggling with the increase in opioid overdoses that has affected most other parts of BC.
We had several providers driving up from Williams Lake to provide some service to our patients in town. We also had some physicians from Prince George helping out and servicing our patients via video conference and link. So Deb played a pivotal role in establishing a local clinic that would address the needs of the patients of our town.
In 2014, Debbie was asked to take on the dual role of Health Services Administrator for Robson Valley as well as Quesnel. In her usual manner, Debbie stepped up to the challenge of providing leadership for a large geographical area, building relationships with communities, staff, and physicians, and ensuring that quality healthcare services were provided in both communities. As Northern Health's Senior Administrator in Quesnel, Debbie's leadership was instrumental in the calm, purposeful emergency response to the 2017 wildfire season.
In the 2017 wildfire season, Quesnel received 23 evacuated patients, and during that time it was Debbie's leadership that made us be as successful as we were. From her practical abilities of being on the floor and supporting frontline care, including feeding patients, to going out and getting items for long-term care patients from stores.
I got into nursing because I enjoy helping people, and absolutely I did that through my nursing career. And then when I got into leadership, I realized that I was still in a position to help people. It's just the audience is different and the way I helped was different. So as a leader, I believe it's my role to remove the barriers and the obstacles that get in the way of my team from bringing their best every day, which again helps people at the end of the day.
I watch her in meetings be vulnerable when she doesn't know and own that, and allow the opportunity for other people to come to the table and bring that knowledge and bring their gift no matter where they are or where they're working, and that's allowed for such amazing outcomes and creative solutions that's allowed us to be effective.
Debbie, for always rising to the occasion and doing whatever is needed to support your community's healthcare needs, you are this year's healthcare hero for Northern Health. Generously sponsored by Pacific Blue Cross.